Afternoon. I'm going to call this oversight hearing to order. Today we're here to examine the Indian Self-Determination and Education Assistance Act. I call it ISDEAA. Does anybody else call it ISDEAA? There's been such debate about the correct pronunciation. So as a committee, I would like us to agree on just calling it ISDEAA? ISDEAA.
Defer to the chair.
ISDEAA. Indian Self-Determination and Education Assistance Act, if we use that every single time, this hearing is going to be twice as long, so it's ISDEAA. But we're also going to talk about its successes at the Department of the Interior and IHS. This year, on January 4th, we marked the 50th anniversary of ISDEAA being signed into law. Passed unanimously by Congress, ISDEAA transformed the relationship between the federal government and tribes by empowering them to take over the administration of federal programs and services that serve tribes, tribal members, and Native populations, and tailor them to their communities' unique needs. Historically, these programs and services were provided by federal agencies directly through the BIA at Interior and through the IHS at the Department of Health and Human Services. Over the past 5 decades, tribal nations have proven time and again that self-determination and self-governance work. And they work because no one understands the needs of Native communities better than the communities themselves. And when tribes are in charge of the programs that serve their people, outcomes improve, opportunities grow, and cultures thrive. Alaska is a perfect example of this. Take the Alaska Tribal Health Compact, which was established early in the self-governance era. It showcases what's possible through self-governance. Alaska is the only state in which over 99% of health programs are managed by tribes and tribal organizations, and it has led to world-class healthcare and public health services to over 170,000 Alaska Native people, from Anchorage to the most remote corners of our state. But it's not just in my state of Alaska. Many tribes across the country have built effective programs over generations using ISDEAA, investing their own resources, training their own workforce so that they better align with their culture and community needs. These are the models of local innovation and sovereignty, and they deserve both protection and sustained support. In order to continue and build on these successes, we need federal agencies to be good partners. Having the right people, departments, and processes in place to approve and enable ISDEAA agreements is essential. Now, I do have concerns about how the executive orders on optimizing the workforce across the federal government and reductions in force are affecting tribal programs. So I've reached out to both HHS, DOI, and other departments, urging each to exempt tribal programs and staff. My colleagues and I have heard regularly from Native communities about changes to service delivery and processes, empty staff positions, shortened deadlines, and ever-circling rumors of perhaps more changes to come. So right now, it's more important than ever for Congress, the administration, and tribes to work collaboratively and seek solutions that work for their communities. We know the benefits go beyond Native communities into every corner of the country. So I want to thank all of our witnesses for being here today. I know that the trip to DC is not always an easy one, but know that your time and your expertise are invaluable. The insights you share will help inform our continued work to strengthen federal programs and uphold the promises made to tribes and Native people. So I look forward to your testimony. I now turn to the Vice Chair for his opening statement.